Hey there, it's Dr. Brian McKay, Core Health in Darien. Today, the FAQs we're going to be dealing with are cervicogenic headaches. So what happens is people will send in questions, and a lot of the questions are good. So what we do is we call through the ones that are pretty good ones that we would think more people would have the same question. So if you have a question regarding anything on health, you can always reach out. Just send an email, McKay Darien at Yahoo, McKayDarien at Yahoo, and put in the subject line podcast questions. And you can, any health topic you want, I'm more than happy to answer. But what we do is we'll take when we see several people asking the same question, we'll hook that up as an FAQ and then bring it to the podcast. So again, here's a couple ways to do it. McKay, McKayDarien at Yahoo. So it's McKay Darien at Yahoo. Send me it, and again, put in the subject line podcast question, and I will get back to you usually within a day or so. So hopefully it's not too long. We've got particularly burning questions. So today we're going to talk about cervicogenic headaches. Now, people usually lump headaches either migraine or bad headaches, tension headaches, stress headaches. But the nature in many cases that I see are cervicogenic headaches. They are not fun, but no headaches are really fun. So let's get right down to some of we break the questions down to are, can, how, what, where, when, who, all that stuff. Let's start with the are. Okay, are cervicogenic headaches dangerous? They can be dangerous because any headache could really be a serious it could be a brain tumor. It could be something more serious than I could treat. But a headache is a headache, so pain, you need to be aware of it, and that's probably the biggest thing. Is that, a lot of times I'll send people out for MRIs, and sometimes they get mad when they get the bill, but I need to make sure that the person's in the right place for the right condition. So my exam will tell me if a cervicogenic headache is possible, but not all are. So yes, cervicogenics can be dangerous. And next question is, are cervicogenic headaches painful? Most of them are. I mean, it's the dull ache. It doesn't, when you have a dull ache and you pop an Advil or Aleve or Tylenol, it goes away. It's not terribly serious because you can mitigate the pain on your own, but it can be painful. And the next question is, are cervicogenic headaches permanent? Yeah, they don't have to be. Usually headaches, don't resolve. Some headaches do resolve. I see women go through menopause and the lifelong headache suffers just stop. So in that case, maybe it was hormonal headaches. Now there's less hormones running through the body as they age. But they don't necessarily have to be permanent. I really guess I've never seen anybody with permanent headaches because I get most of the people better. His next question: are cervicogenic headaches constant? Yeah, they can become constant because if you just pop the Advil or Aleve, or you go for your monthly $5,000 shot of Botox for headaches, you're not really addressing it. Cervicogenic headache means it starts in your cervix. It's originally in the cervical spine. Cervical is a region where we find a lot of these subluxations that can cause headaches. Moving on, are cervicogenic headaches common? Yeah, they're pretty common. But it'd be rare to find a GP or a neurologist say, "Hey, go see a chiropractor for your headaches." But I mean, it's like you should come running to a chiropractor when you have headaches because it rules out all that bad stuff. So if we can fix your headache, excuse me, we can fix your headache. I don't consider it to be serious. I consider it to be a biomechanical oops. Something goes out of place, puts pressure on the nerve. It could also put pressure on the brainstem. So it's definitely, are they common? Yeah, they're common. It's kind of a little repeat. Cervicogenic headache serious. Yeah, it's serious. If it interferes with your life, are you doing the things you like to do, or you're not doing it because of these headaches? So that's something to consider. I mean, by all means, it depends, on how much pain you can take, especially when it can be fixed. That's the thing but you'll never know if you don't go to a chiropractor. And many chiropractors, it doesn't have to be one particular technique. You'd be surprised at how many headaches respond very favorably to chiropractic care. Is cervicogenic headaches curable? I believe so, but the only way to know is put somebody on a treatment plan. Conservative treatment plan. There are some home exercises, but not a lot. And the next question is cervicogenic headache a disability? Yeah, it can be. I mean, headaches can be disabling. Um, I think you have a hard time getting that through if you're looking for Social Security disability. I mean, a headache is in your head. It's not something you can see. It's not like someone coming in who's missing a leg or is in a wheelchair. So you really, you don't seem to be sick, but I mean, you have a chronic headaches. It does impair your ability to sleep, uh, your ability to function, your ability to work. So it really can have these far-reaching, devastating effects. You know, let's moving on. Can cervicogenic headaches be cured? Yeah, I've seen it all the time. Chiropractic care. Now, here's a really good question. Can cervicogenic headaches cause vertigo? They definitely can cause vertigo. Definitely, because what happens is you have up until cervical number two, which is called axis, you have you have brainstem, and the brainstem, if it gets squished on by either the opening at the base of your skull called the foramen magnum, or through the arch of Atlas into C2 axis, you could definitely have pressure on the brainstem, which can cause vertigo. Um, Here's one: can cervicogenic headaches kill you? I don't think so. I really don't think so on that one, but you never know. It could cause somebody to take their lives into their own hands if the headaches are that bad. But hopefully by that time they would have seen somebody, and there's enough powerful medications. But that's actually, I don't know how that silly question got in here. I have to ask my office manager. Put these list of questions together from the emails I culminate on. All right, can cervicogenic headaches cause nausea? Yes, definitely causes nausea. Uh, Part of it from the vasovagal response, and I'm not going to go into that now, but it definitely can cause nausea. Here's an easy one. Can cervicogenic headaches cause fatigue? Yes, cervical headaches can cause fatigue. Very much so. And here's why. You can't sleep if you have all these subluxations in your neck. And basically what a chiropractor is going to treat in the nature of a cervicogenic headache is going to be um, it's going to be subluxations. So yes, it definitely can cause fatigue, and it's a really big problem because then you're more tired the next day. It's kind of like having a monkey on your back. You have to work just as hard to get through your day, and it doesn't always flow that easily when you have it. Now, can cervicogenic headaches cause migraines? Listen, for all argument's sake, a bad headache is a migraine. People, yes, there's ocular migraines. There's some migraines that you don't feel, visual migraines. But for the most part, it's all lumped in as headaches. And people tend to say if they got a bad headache, it's a migraine. A regular headache, it's a sinus headache. So it's really it's a lot of self-diagnosing when it comes down to it. But anytime you get a bad headache, it's going to be called a migraine for the most part. It's I guess until you rule out a brain tumor. All right, here's the good one. Can cervicogenic headaches cause ear pain? Yeah, definitely. Um, your occipital bone can, if the occipital bone to atlas to axis, which is C1, C2, atlas axis, if they are subluxated enough, it can put a serious block on these station tubes. And these station tubes could actually, some forward-thinking moms bring their kids into the chiropractor to avoid ear infections. And it does make sense. It really does. So yeah, it definitely causes ear pain. How is a cervicogenic headache diagnosed? That's a really, really good question. Well, one, your history is a big part of it, but when you take an X-ray, almost everybody with cervicogenic headaches has an interruption of the normal um, cervical one to cervical one is tilting in a certain direction that could put pressure right into your brainstem. You got to figure the brainstem comes down cervical number two axis. So, but what I typically see is I see a loss of curvature invariably everybody coming in who has a headache has this loss of curvature. And I'm generalizing because that's what I tend to see, but it does happen. So when I see that, I am definitely concerned, because that curve not only puts pressure on the spinal cord itself, it could be tugging at the brainstem. So that's the type of thing. Is like, if say you have a string that's 12 inches long, and now you're bending it, you're trying to stretch it, and then you have bone pushing into it, you can have some serious headaches as a result. So don't discount it. But typically, I like to see the cervical X-rays or cervical MRIs. If that thing. Now, how long do cervicogenic headaches last? Well, sometimes until you fix the underlying cause. If there's subluxations, it usually takes about 2-3 weeks before people start seeing any kind of results. And how to treat cervicogenic headaches? Well, chiropractic adjustment is one of the best ways to do it. Um, Neck traction in conjunction with the headache is a very good way. And how do we relieve them? How do you relieve a cervicogenic headache? Quick answer: go see a chiropractor. You need to find. Hey, listen. The other thing too is you need to find a chiropractor. Give us a call: 203-656-3636. 203-656-3636. I'm more than happy to refer you to somebody. And I'll make sure you get somebody good based on your area. It's not a problem. It's to be a service. But thanks for listening to this podcast. How do you prevent cervicogenic headaches? Keep going to the chiropractor, but I'm not talking about every. You go once every month, 2 months, 3 months. You find that right schedule. You have to think of as a chiropractor as a mechanic for your spine, and mechanically, if you're breaking down, we need to fix you. It's really that simple. Fix the mechanics, fix you, and you don't have the headaches anymore. But there's always going to be a default. Like if you have headaches for 15 years and it takes 6 months to get rid of get that curve back to where it needs to be. Well, you're going to have a problem. That's just the nature of it. So, you want help with cervicogenic headache? Go see your chiropractor. Massage is another thing too to consider, because the muscles are affected. But it'd be much better to get a chiropractor that does massage as well. And that's what we do here. In my office, we have a physical therapist. It's a certain purpose for them. We have plenty of we have massage therapy, because it's in conjunction. I move the bone, the muscle has to catch up, and that's important. It's crucial, as a matter of fact. It really is. So that's how we help it. We use a lot of different modalities. We use cervical traction, cervical traction adjustment, spinal adjustment. Sometimes we do Groston or IASTM, which stands for Instrument Assisted Soft Tissue Manipulation. So there's a bunch of things that we do here. It's the physical therapy. So there's not any one particular thing, but once you recognize what you have, you get the right treatment. You'd be surprised at how, what goes on here. So here's a couple of questions, kind of redundant, but we'll hit them. What are cervicogenic headaches? Cervicogenic headaches are headaches that originate in the neck. So there's a subluxation in the cervical spine causing a particular problem. What do cervicogenic headaches feel like? Your head hurts. Typically, it starts at the back of your neck and goes up over or wraps around your head. And next question: what helps cervicogenic headaches? Chiropractor, yeah. When they're minor, you could listen. If you need to take Advil or leave to get through the day, that's. But you realize that, okay, so you took care of it today, and it comes back. It's like a toothache. You can have a good day with a toothache and a bad day with a toothache. It's going to come back, and eventually you have to go see the dentist. Most people are okay with that thought. Most people, the idea of going to a chiropractor, don't go see a chiropractor. When I was a kid, I told my doctor when I was going for a physical, and I told my doctor I wanted to become a chiropractor. He had a shit fit. Told me to become a garbage man instead. So there's a lot of people who really don't know how effective chiropractic care can be, because they're not trained in it. Given that much, but also too is you have long-standing biases from the medical profession. Like, I have a patient now, and she's pregnant, and she's like, my obstetrician says, don't go to a chiropractor. I'm like, all right, that's your decision. I don't support it, because quite honestly, we need to keep our pelvis moving healthily in a healthy fashion, and that's what we would do. And it does make the pregnancy go easier. So you have somebody who has an opinion, but what fact is she basing her OB basing that on? I really don't know. Here's what triggers cervicogenic headaches: loss of curve in the neck, subluxations in the neck, and which infections. Really, if you have an infection causing a headache, you really need to be at the medical doctor's office, not seeing a chiropractor. Um, Chiropractors do not treat infections, so it's really important that be you know, let's get that out in the front. All right, who treats cervicogenic headaches? That's a good question. It really is good. I'm of course I'm biased with chiropractic, but there are physical therapists who do joint mobilization, which is the same thing as chiropractic adjustment, just a different name. I mean, I see people, physical therapists who are essentially acting as chiropractors, but it's my in my estimation, chiropractic and physical therapy should be a combined profession because they really just how do you speed the person's healing process? If you just do soft tissue as a physical therapist and the bone's out of place, well, you're doing half the job. So it's really not it's not what you need. So, um, you know, so who to see? I would say chiropractor first. Acupuncture too. Acupuncture does help. I mean, sometimes there's energy imbalances that are causing these headaches. So I would seriously think about that. Um, I would definitely think about that. As a matter of fact, it's not you know, I recommend patients to acupuncture all the time. And then again, it's physical therapists who do so. It's doctors who treat cervicogenic headaches. A lot of physical therapists have PhDs now. It's not an MD. They go for a PhD in physical therapy, and if they are attuned with adjusting skills, they're going to mobilize your neck and probably do a pretty damn good job. Uh, just go meet them, ask them, see if you trust them. Let's go. We're running through the list here. We're almost down to the bottom. Yes, cervicogenic headaches cause migraines. Migraines just a bad headaches. It really, I mean, I'm simplifying it for the most part. So I would say, I can say cervicogenic headaches will cause bad headaches. Okay, let's leave it like that. As far as causing migraines, um, that's a judgment call. I'm going to defer. Fatigue, yes. Can cervicogenics cause fatigue? Definitely. We've gone down. Okay, here's a good one. Can cervicogenic headaches cause vision problems? Hell yes, they can cause vision problems and many different problems. So can cervicogenic headaches cause vertigo? Yes, they cause vertigo. Um, can cervicogenic headaches cause nausea? Yeah, we've gone over that. And dizziness, yes. That's another one that cervicogenic headaches can cause dizziness. And we mentioned that before with the subluxation in the occipital atlas axis area primarily. And that kind of tags into the cerebellum, which is in the back of your head. So yes, cervicogenic headaches can be cured. Find the right chiropractor, right PT, right acupuncturist. Don't forget a little massage is not a bad thing as well. If you have any questions, give us a call. You can reach us at 203-656-3636, 203-656-3636. Dr. Brian McKay, Core Health in Darien. I welcome your questions. And anytime you want, give me a call. Oh, give me a call, but it's more likely to get an answer with an email. Remember, McKayDarien@yahoo.com. In the subject line, put podcast question. And that's McKayDarien@yahoo.com. Thanks for listening. I hope I answered your questions. Bye.